Today, you all are going to listen to the topic on organ donation and transplantation. And before I actually begin my talk, I would like to tell you a short story. This is a short story about a young farming couple from Horopatana. They're having their first child born on 25th of January 2021. And everything went okay for them, except after the first few days of life, the child was turning upward, and the eyes were actually turning yellow in color, and the stools that the child passed was turning white. So this was pretty abnormal for the family, and the child was rushed back to the hospital. And the child was thoroughly investigated, and then again identified as child suffering from congenital biliary atresia. This is a clinical condition where the duct system draining bile from the liver to the digestive system is absent or rudimentary. It's fairly lethal condition where there's no survival unless the child has a liver transplant of that. So the child is determined to get a liver transplant on an urgent basis. But this is a few days old baby. But how are we going to do this transplant in Sri Lanka? Unfortunately, we didn't have that kind of transplant facility like in our country. So the only place where this could be done nearest was India. So there were a couple of issues. Who is going to donate? And how am I going to get this liver transplant organized? Because there's a lot of money involved in this procedure. So anyway, as usual, mother was happy to donate with kindness. However, there are about more than 8 million rupees which should be required to get this liver transplant done in India. So this is a poor farm family. There's no way that they can afford this much money. So then again, there were these all people gathered around the world. Actually, there were Sri Lankans and Australians. They were actually willing to donate and actually gathered some money. And this took a fair amount of time for them to organize this. And during this process of organization, so Charles' clinical condition became suddenly bad. And Charles, a week before Charles was prepared to go to be taken to India, Charles' clinical condition became worse and Charles died. So this is a tragic, actually. There's so much effort that was done by the family and the people who were willing to donate, but there was nothing at end. So, my dear friends, this is just the tip of the iceberg. What you see actually is not what is underlying. So if you go to social media on a daily basis, you might see these kind of peers and pages asking for organs for donation. There's another boy, young boy, and requiring organs to survive. And this is a young lady, a 12-year-old young, beautiful girl who's having liver failure, asking for some part of organ to survive. And this is another boy. It was there on social media. And Charles was determined to get the transplant done in Sri Lanka, this much older boy. However, there's so much money involved. Despite the fact this is done in government sector, there's some amount of money that's required. You can see the background, how poor these families are. And so they are asking for money. So this every day you see these kind of notices and the prayers. And look at this two persons. On the left is on the right is the young lady who's having liver failure due to cirrhosis, and the next is the mother. So the mother was actually planning to donate the liver, actually part of the liver, but mother was recognized as overweight and not suitable for organ donation. So this child is left nothing. My dear friends, during my next 45 minutes or so, I'll be talking to you about what the organ donation and transplantation look like, and how do we need to donate, and what's the quality of life and impact of organ failure. And what are the types of donors we have? How about the live donors and disease donors? And how I become a donor? And what happens after organ donation? Are there any potential risks involved in this procedure? And what are the ethical and legal considerations? In simplest term, organ donation is expressed as a surgical technique for removing an organ or tissue from one person and placing it to another person, which is known as organ donor and recipient. And this recipient is actually having malfunction of the organ, which should be transplanted to survive. So this is easier said than done. There's so much of underlying factors to think before we proceed with this kind of procedure. I'll talk about that as I go along. There are 6 types of major organs that we can donate, but one of the predominantly transplanted or donated organs is the kidneys and liver. But across the world, intestine, pancreas, heart, and lungs can also be transplanted. And there are other tissues also which we can donate, and ones which cornea predominate. If we go back to the history of the transplant process, this goes back to 1950s, when Dr. Joseph Murray first ventured and then did his first kidney transplant in the world. And this was done in Peter Brigham Hospital in Boston, and this made a landmark surgery in the US. And so he transplanted it actually identical twins. So the twin was, the other one was actually suffering from end-stage kidney failure, and that led to his twin donating the kidney, and that made him survive after the transplant. This was a very successful operation. And almost about 10 years after the first kidney transplant, so Dr. Thomas Stansel actually ventured and got with the liver transplant. So this was again another landmark surgery in the transplant history. This liver surgery, unlike kidney transplant, is not as small as if you think about the operative procedures and time going on. So this was the heroic work that he carried out. So first 5 of these transplant patients didn't do very well. They just survived for less than 23 days. But he continued to pursue it and pursue his activity. And now after 4 years of his first attempt, and then in 1967, he made a landmark success in the process of liver transplant. But this has been with the help of the other immune suppressions, which was coming up because of the understanding of the value of suppression. My dear friends, why are we talking about the organ donation today? So what is the real problem involved with this procedure? You know this. Those who are Buddhists or having some Buddhist background or culture, we know this slogan, Arogya Paramala. The health is the ultimate profit we have. Nothing is important because we are healthy. When we are healthy, we can eat, think, and do whatever we want. But when we are sick, only we understand the value of being healthy. This gentleman is looking smart, isn't he? He's very handsome, you might say. My dear friends, beauty is not simply, you see, the organs inside our body are trying tirelessly and working tirelessly to keep us fit and healthy. One of the organs is the heart, but there are the 3 organs which have the lungs right side, and the liver and the kidneys behind in the tummy. They're all working very hard, and smooth functioning of these 4 organs are very much required for us to stay alive. Look at this gentleman. He is suffering from end-stage kidney failure. He is attached to this machine, which is called hemodialysis machine. And he has to get this hemodialysis every other day or so, at least minimum of 2 days per week, 4-hour sessions for his test. He has to get this blood purified to this machine, and then only living afterwards. Otherwise, he's fully abnormal. He's not the only one. There are multiple people like that suffering from the same disease. This is actually a picture of the hemodialysis center in Garment sector. Dear friends, worldwide kidney failure is growing so immensely. 10% of the world population has kidney failure. And more than 2 million people, or almost 2 million people, will receive actual treatment, which is dialysis or the kidney transplant to stay alive. That is only about the 10% of the kidney failure patients. So what happens to the rest? Just the 90% of the patients will simply die. There's no hope whatsoever. The condition with the kidney is also the same. Condition for kidney with the liver is also the same. In worldwide, globally, about 4.5 to 9.5% of patients are there with the cirrhosis. So in Sri Lanka, incidence of kidney failure is also rising. It's actually doubling every 45 years. And more than 150,000 people affected by the disease. And 3 of them actually will lose their life per year. So this is a record study done in 2015. But now we talk about the current status. This is should be much higher than this. So if you go by the geographical distribution of the disease pattern in Sri Lanka, so one in red appears the highest number of cases reported in north central part of the country, which has the highest number of patients reported. If you talk about the kidney failure by itself, the majority of them will not develop symptoms until about 15% of less than 15% of the kidney function get lost. Until that time, patients will not have much symptoms. Afterwards, they become pretty unviable, and they will actually gain a lot of water inside the body because water cannot be excreted, and they will be restricted of taking fluids. So they will have to take only 500 ml of water per day. So that is pretty much annoying. And the other thing is they will have lethargy, tiredness, and you can't let go energy and everything. And also part of that, you will not live longer. That's the biggest problem. What about the liver failure? The liver failure is the same. You see this young man is turned to be a monstrous looking appearance because of the liver failure. You see the pot belly, large belly, and there are a lot of water retained inside the tummy, and there is some cirrhotic liver. And
Aruna, can I disturb you for a second if that's okay?
Sure.
I think the voice is getting a little bit unclear. 2 reasons I can think of is one may be the fan, and the other thing you might need to take the mic kind of a thing in your headset closer to the mouth, I think. Yeah.
Okay. Can you hear me well now?
I think now it's better. Yeah. If you can just take it close to the mouth, that would be better. Thank you.
Okay. Thank you. All right. Sorry for the disturbance again. So, my dear friends, look at this gentleman who has the liver failure and he's turned to be a monster-looking appearance. He has pot belly and there's so much water retained inside his tummy, and he has a cirrhotic liver. And even if you're a male, so you might get some male breast enlarged. So that's a condition called gynecomastia. And you might be feeling pretty awkward, and your eyes may be turned yellow in color, and urine may be turning dark in color. And so this is the pretty bad shape that you get when you get liver failure. And this affects not only adults, and the children also have the same problem. You see the pot belly is child's height, and they can't do anything. They're quite helpless. There's no help whatsoever unless you get a liver transplant for this kind of patient. They can't speak, but so they can't express their views. Unless they cry, there's no other way they can express themselves. If you go back to the actual figures again, annually there are about more than 2,000 people dying of either liver failure or kidney failure. If we go very close to the 2019 figures, we can appreciate the number of patients dying of kidney failure is over 2,169. And same, pretty much close is the liver failure due to cirrhosis. So, my dear friends, more than 2,000 people are dying of each organ failure in Sri Lanka. Okay, do we have any type of solution for this kind of organ failure? Yes, it is transplantation. There's nothing else. Okay, we have different types of organ donation. We'll talk about that now. We have the cadaveric or the brain dead donors. Then, of course, we have the other type, which is called live donation. This is all governed by the Human Transplantation Act, which was published in 1987. And it is very well written, and we have to follow these guidelines. And so there's rigorous assessment of this process of donation and transplantation by Sri Lankan court of law. And then I'll introduce about the brain death and brain death concept. So this is actually came into clinical practice in 1968 when the Harvard ad hoc committee defined this condition as irreversible coma as a new criteria for death. But then, of course, there was a lot of criticism and debate going on the topic because no one was sure in 100% times this one was dead or alive. So, in 1981, there's a landmark Death Act which came into practice. So that was very well written, and it was said that reversible cessation of circulatory and breathing functions should be regarded as a state of brain death state. So then we can go on the brain death assessment and so on. So if you go by the brain death, so this is the brain and this is the spinal cord. There's a connection in between the spinal cord and the brain, which is called brainstem. The brainstem is the one actually controls most of the spontaneous activity, including breathing and the muscles and the reflexes and everything. So when the brain is dead, so the brainstem is the actual one that should be functioning. So if there's no brainstem function, so of course your brain will not have any adequate function and will not survive. There's kind of a irreversible state. All these things actually came into practice within development of intensive care units. So in the 20th century, we have made so much advancement into that technology and medicine. So a lot of equipment to support organs have been devised. So this all made some change in our practice in intensive care patients. So there are these patients who have got brain death, but still their heart, lungs, and kidneys are all functioning, thanks to the machines attached. So their patient is kind of in a vegetative state, not kind of a live, but kind of a brain death state. So patients will have just normal functioning heart and other things, but not the brain. So this picture shows you how brain death is confirmed, and this is actually testing done by 2 qualified doctors. One of them actually should be having more than 5 years. One of these actually a consultant. Both of them have more than 5 years of clinical experience. And this testing is a kind of a rigorous assessment done twice by two doctors at least 6 hours apart. So there's no any room for error for this kind of procedure. So we always rule out any possibility of any reversible cause before we embark on that kind of procedure, like drug intoxication, hypothermia. So these are some of the diseases which actually can make patient become comatose, but still patient can recover later on. So we always exclude these kind of situations. And there are criteria, and also there is a lot of tests that we carry out. This picture shows you some of the important tests that we do in the ICU care. So the most important thing about this is, as I said before, there is no room for error once the brain death is confirmed. That is it. So I'll just summarize how it happens. So when the patient is first admitted with fatal injuries or critical illness into ICU care, so patient's brain death will be confirmed by two competent doctors. And then the next thing would be to go for organ donation. And so, of course, then we need to have the consent from the next of kin or the relative or the guardian for this procedure to be carried out. So this process of organ donation transplant is coordinated by a transplant coordinator, which was appointment. This is an appointment done by the Ministry of Health, which is the independent group involved, and we will coordinate. He or she will actually coordinate the JMOs and coroners for the consent and everything. So once they have done this consent form signed, so then of course the transplant team members get involved. Until that, we are not getting involved. So this is quite independent kind of assessment. And once that's done, organ retrieval and suitable organ transplantation is carried out. So once organs are retrieved, organ will be, the donor's body will be closed and respectfully handed over to the relatives without undue delay. So during the process of organ donation by cadaver, which we call as cadaver, the organ is packed in ice with preservative fluid, and then of course can be transported even to a very distant place. So that can be taken by air even. So commonly it's transported by an ambulance. So no matter where the organ is, we'll be ready to go and collect organs and retrieve organs and transplant it to a different patient, because this is so much important. So there's always the organ preservation time. We need to know there's kidney and liver will survive 72 hours and 12 hours respectively. So rest of the organs will have different varying duration of survival after the organs are retrieved. But this is after the packing in ice with preservative fluid. Okay, what happens if we don't get the consent for organ donation? The next thing that will happen is that the relatives will be informed about the bad news. And then, of course, we will have to go for the disconnection of the supplying tubes of oxygen and other supports. And then the heart will stop, and then the dead body will be handed over to the relatives. Because this we know that once a brain death is confirmed, there's no way that particular patient will recover. So this ICU care and ICU bed is so important because there are so many other patients waiting to get an ICU bed. So we have to give opportunity for the best people, and we will simply go in this pathway. My dear friends, one organ donor can actually save 8 lives. Isn't it amazing? So the kidney, once it's transplanted to a recipient, will have another 10 to 15 years of good quality life. So is the liver. What about the cornea? And so are the other organs. So, my dear friends, take another 100 years from today. Don't you think that none of us will be alive by that time? You may be actually donating food, money, shelter, and everything during your lifetime. What about the death? Death is doomed, for sure. But we can actually recycle our organs. And we can actually enhance our spirit by recycling our organs after our death. So isn't it amazing? Dear friends, when you are still alive, we can have something like that. We can actually give our consent to the donation once you are dead. So this is a donor card which is published in UK. So if someone is interested in donation after once the patient is actually confirmed, so this facilitates the process of organ retrieval without any undue delay. Next, actually, I will talk about the organ donation, which is live donation. So live donation, there are 3 types of donations. It can be living related donor, it can be living unrelated donation, or non-related donation. So the living donation actually can be a family member, such as a parent or child, or brother or sister, or else if it is a living unrelated donation, it has to be emotional related recipient, such as a good friend, a spouse, or so on. So it can even be an unrelated donation, but somebody who is very strange, but it has to be anonymous donation. But this process is very rigorously assessed and scrutinized. There should not be any money transaction whatsoever. And this is all to do with the voluntary donation and with voluntary consent. There's no forceful consenting that's required or accepted. So most important concept behind this donation is to ensure there's no harm done to the donor. The donor should be as good as the recipient or far better than the recipient. That's the safety of the assured. So, kidneys, we have 2 kidneys. So one of these kidneys can be given. And once that kidney is given to another one, the kidney function that is lost will be regained within the next few weeks. So there's no harm done to the donor. And what about the liver? Part of the liver actually can be donated. And once that's donated, within the next few weeks, probably 4 to 12 weeks' time, the liver will regenerate to its normal or original position. So that's very remarkable. So there's no much harm whatsoever. So look at this family. This is a father, this is the son. The son has donated his part of the liver to his father. So both of them look very happy at the end. So live transplant and donation is actually a kind of a very rigorously assessed, scrutinized process, as I said before. So once you have a potential donor, you get donor consent and issues assessed. There's this matching them assessed with the blood grouping and even histocompatibility complex, that's HLA. And then, of course, we undergo a legal process of with the help of the ethics review committee. So this takes time. And then final authorization is given by the Ministry of Health, DGHS. My dear friends, let's go to some of the successful stories we have. By now, these are the current figures we have actually done in Sri Lanka. The National Hospital itself, there are about 138 transplants that have been performed. But what matters is the number of transplant as a cumulative number. This kidney transplant is actually less than 2,000 taken altogether by 2021. And if you talk about the liver transplant, it's less than 100, or probably less than 200 by 2021. So this is quite not acceptable. There are, as you can remember, there are about 2,000 people dying of each organ each year. So, but these are the numbers we have done, and these are the problems we have at present. So whatever the rest of the people actually die within a very short period of time once they are diagnosed with organ failure. What about this eye donation? My dear friends, Sri Lanka is predominantly a Buddhist nurtured country. And there are always people happy to donate. That we know for sure. This eye donation is one of the classic examples for that. This one was actually first organized and established in 1961. And so this was going on pretty well. And nowadays, actually, we have actually donated more than 100,000 corneas, not in Sri Lanka, but across to 62 other countries. And the ones which Pakistan also were getting involved. We have a successful pediatric transplant in July last year. So this is another story actually. This patient, 9-year-old girl from Jaffna, had end-stage renal failure. Sorry, end-stage liver failure. And so there was no hope for survival for this girl unless she had a transplant. So we have actually been chaired for this process, led by Professor Srivardhan et al. So this is the state of the child for transplant, and this process has been going. And during this process, we have removed the liver and transplanted. This is the happy face of the child after the transplant. And this is the mother, and this is the child. So this is mother-to-child donation. And look at this child now, 1 year down the line. She's looking pretty well, isn't she? This is the second child who had the liver transplant. So she's also looking great now. And this is the first kidney transplant done in Ragam. So they are doing very well. And there's another transplant patient. So before the transplant, he was having necklines, and his life was pretty poor. And the quality is so poor, and he's looking pretty well now. And look at this patient. This patient had end-stage liver failure, and he was dark in color and see his monstrous appearance. But after the transplant, he's pretty fair, and he's at his normal activities now. So, my dear friends, we have an excellent team of doctors grouped together under CNCLT, dedicated to have liver transplant done fruitfully. So, my dear friends, let's donate, make a change. You can actually do it twice. Thank you.